Hello friends, I'm Dr. Rohit Batra from Dermaworld Skin and Hair Clinics, New Delhi, and today we are going to talk about vitiligo, camouflage, and what a patient needs to take care on this platform that is dermavidya.com. We are here to talk to you about various skin issues that are there in our society. Vitiligo is something that we all know is very much there in our society, but when we see a patient of vitiligo, either we move away from them or we start talking about all the myths that are there in our society. That you would have eaten something, you must have taken fish with milk. All these are myths. And when it comes to a vitiligo patient, we should help them tackle with this problem, which is not only affecting their physical appearance, but also there is a lot of mental agony also in patients who are suffering from vitiligo. We have a lot of treatments in vitiligo, then be it narrowband UVB, some topicals, oral medications. There are treatments which help in controlling the disease, and there are treatments which help in repigmenting the depigmented areas. Depigmented areas means the areas that are turned white. Now, when these patients move out, they are reluctant in going to social functions, to their office, because they feel that everyone is looking at them and is looking at their white patches. So there are camouflage treatments that are available. That is something like females use in your day-to-day practice when they use a lot of makeup. That is a concealer. A camouflage is something like a concealer, which when applied to a white area will just cover the area, and the camouflage cream depends on the skin tone of the patient. We have nowadays camouflage creams that are waterproof also, and there are specific waterproof agents also, that once you have applied the cream, over and above, if you will sprinkle that waterproof powder, so even if the patient is washing hands a couple of times, the camouflage cream will not go anywhere, and they can go about doing their normal work in their offices, in their social gatherings, and even at their household stuff also they can do. But one thing that needs to be taken care is, if they are using too much camouflage, they're not applying the creams, then the disease treatment takes a backstage. So we tell our patients to use the camouflage cream only when they are moving out, and rest of the time they should cater to the problem that is vitiligo in consultation with dermatologists, who will give them few creams that might contain a mild steroid, a tacrolimus, or for that matter, nowadays we have JAK inhibitors that helps in getting the pigmentation back. Also, vitiligo patients, depending on what sort of treatment they are taking, are advised by their dermatologist to have a certain amount of sun exposure also. At times, we give few oral medication and ask the patient to go for a sun exposure after a couple of hours for 10 to 15 minutes. And in case the patient is suffering from vitiligo, Kibnos phenomena, that is, whenever there is a trauma, you get a white spot, then your dermatologist might ask you to avoid sunlight also till the time the disease comes under control. So you should always consult your dermatologist about the condition and then only start with the treatment or camouflage. Your dermatologist will guide you how to get the pigmentation back, at the same time how to get the smile back on your face if you are suffering from vitiligo. So in case you are suffering from vitiligo, visit a board certified dermatologist in your near vicinity, talk to them about your condition, talk to them about your profession, and they will give you the best treatment as well as the best camouflage. If you like the video, do subscribe to the platform that is dermavidya.com, and we'll be sharing various skin, hair, and aesthetics needed information, and will be giving you knowledge from time to time on this platform. Thank you.
For more such videos, visit or log into dermavidya.com.